All right, hello people. I am here joined today by my husband Kurt, and we're doing this video today because he is 2 weeks post-op for bariatric surgery. And one of the reasons I wanted to do this video is because the particular type of surgery that he had done, it's called SADS, which stands for Single Anastomosis Duodenal Switch. It can sometimes also be called SIPS. It's a relatively new procedure in the bariatric surgery world. It's about 15 years old. It's been done about 15 years old versus some of the other surgeries that have been around for over 50 years. That may not seem really new, but in the medical world, it kind of is, because even insurance companies, a lot of them don't cover it yet. So therefore, I don't know how many people actually have been getting this surgery. I haven't seen too many videos on YouTube for people who have had this particular surgery and have given people their personal experience. So I kind of wanted to help people who might be considering this procedure and maybe give them a little bit of a perspective from a personal standpoint. So why don't you go ahead and take it away and tell us a little bit about what SADS is?
So SADS, it's a modified duodenal switch. I do have a visual aid that the Bariatric Center provided, showing a little bit of the differences. So the duodenal switch, it connects to the gallbladder and the stomach, and splits the small intestine, connects them down at the bottom. So there are two full cuts into the small intestine. The SADS, it only has one full cut into the small intestine, and then reconnects the stomach halfway down. If you look at the food path and then the digestive enzymes that come from the gallbladder, the liver, in the duodenal switch, they take separate paths down the small intestine, and in the SADS, they join together, and the digestive enzymes follow the entire path down through the small intestine. So it is considered to be a safer surgery because there are fewer cuts. It takes less time under general anesthetic, and because those digestive enzymes follow the full food path, you have less side effects as far as increased smells during bathroom and gas episodes. You'll have a lot more of those side effects with the traditional duodenal switch than you will with the single anastomosis. So there's fewer side effects. It's a safer surgery.
And it's still a very highly effective surgery.
Yes. The average weight loss for the duodenal switch, which keep in mind there is a lot more data. For the duodenal switch, the average weight loss is 80% of the excess weight, and the SADS is 75% of the excess weight. So it's almost within a margin of error, even though the data set is much larger for duodenal switch.
Yeah. And you forgot to mention that in both of these procedures, they also do a sleeve resectioning of the stomach. So they give you a smaller stomach.
Yeah, so you can see up at the top there, the stomach is cut down. The way the surgeon explained it to me is he puts a tube about the size of the thumb down the throat, and then they use that to size when they're sewing the stomach back up. That's about how thick your sleeve becomes.
So, how exactly does SADS help a person lose weight?
So really three ways. One is a restriction of how much you can eat because of the smaller stomach. Two, because you're bypassing a lot of the small intestine, you absorb a lot less of the calories. I'm not a doctor, but from what I've read, it can be 60 to 70% of the fat calories do not get absorbed, and 30 to 40% of the carbohydrate and protein calories do not get absorbed. So you can't eat as much, and your body doesn't absorb everything that you eat in the same efficiency as it did before. The third way is it manipulates your hunger hormones. So there's two hormones that it primarily manipulates. One is
Ghrelin?
ghrelin,
Ghrelin,
which a lot of times is referred to as your hunger hormone, and that is produced in the bottom of the stomach, the part that gets cut out. So you don't feel nearly as hungry because your ghrelin production is way down. The other hormone that is manipulated is what is sometimes referred to as the fullness hormone, and that's
leptin? Is it?
nope,
No?
nope. If I'm not mistaken, it's GLP-1.
Oh.
And if you're familiar with the Ozempic, Mounjaro craze that's going on, that is the hormone that those manipulate. So that slows down the speed that the food is put through. And GLP-1 is produced in the duodenal section, which is bypassed, which is the upper part of the small intestine. And since there's no food going through there, it doesn't produce the GLP-1, which triggers your digestive system to move quicker.
So, if any of this has been too confusing, since, like you said, we're not doctors, there are plenty of videos out there made by hospitals that actually probably describe what it does and what it is a little bit better. So, but that was just kind of a little bit from what we know of what it is. So why did you decide to get bariatric surgery in general?
So I had done, tried to lose weight several times. I do have a history of obesity in my family, really on both sides of my family. So there is somewhat of a genetic and, learned behavior that is difficult for me to overcome. Over the past few years, I have had a balloon of weight a balloon in my weight, and it has been causing a lot of other health concerns. I've developed degenerative disc all the way up and down my back, in my neck. This has caused a lot of chronic pain, which if trying to lose it traditionally, it's more difficult to lose without being able to exercise as much. Also developed high blood pressure, borderline pre-diabetic. So there's a lot of risk factors that are really direct cause by the weight. And those risk factors really started to outweigh the risk of the surgery.
Yeah, things were just starting to pile up, and we were afraid if we didn't do something that, things would probably go down a path that we couldn't reverse. And, yeah, I mean, you've tried. I've seen you try the whole diet thing, but, it's like statistics say like 95% of diets fail. So that's kind of a depressing thought, but fortunately there are things like the surgery that can help you later on. So why did you decide to go with SADS, the SADS surgery, instead of like some of the others?
So it was really the one that fit me best. I met with the surgeon that did the surgery in 2019. And I've met with him again late last year when I started this back up. Really decided to put the brakes on it in 2019 because of really decided not to pull the trigger then, because it was really late 2019, early 2020, the world blew up. So
yeah, they weren't exactly doing elective surgeries back then.
Right. So that got put off until this last year I started really doing more and more due diligence.
Mm-hmm.
This surgeon highly suggested the single anastomosis, or the SADS, and the backup surgery was the traditional duodenal switch. And he did not recommend Roux-en-Y for me because of some of the specific medical situations that I had.
In many ways, Roux-en-Y is it's almost an outdated procedure, I think. I mean, it's still used because there are still very good reasons to use it.
So the Roux-en-Y, it's still useful for people that suffer from heartburn.
Yeah, but like I feel like that's one of the only reasons why you would go with that instead of some of those newer procedures.
Yes, as far as my understanding is, not being a doctor.
Yes, we're not doctors, but that's what we understand. And then like the sleeve surgery, it's just that's more for people who have less to lose.
Yeah, lower BMI.
Yeah.
You traditionally lose less. You don't have the malabsorption aspect of it, and you're only manipulating the hunger hormone, not the fullness hormone as well.
Mm-hmm. So we felt like that was best for you. So what kinds of things do you think people should know about SADS, or even just bariatric surgery in general, maybe they didn't think about, or they wouldn't know about unless they actually did all this research?
So a few of the things to think about, there's a whole class of pain medication. This relates to me, given my chronic pain, called NSAIDs, non-steroidal anti-inflammatory.
Something.
Yeah.
That includes things like Advil and like meloxicam.
Yeah, there's a full page of that class, but Advil and or ibuprofen and meloxicam are two of the most common. Those they have a risk of producing ulcers. So when you have incisions and cuts in your stomach and your intestines, those risks go way up.
It's going to irritate it.
Yes. So the surgeon said there's a lot less risk with the SADS than there is with the Roux-en-Y, which is one reason that he highly suggested SADS for me.
Yeah. You still won't be able to take it for like a whole year though.
Right.
While your stomach's still healing.
Right.
But yeah, we kind of got some conflicting information from the nurses versus the surgeon. There were some nurses saying absolutely not, never with any of these surgeries, whereas the surgeon was like, maybe eventually you can take some.
Right.
But you were relying on it pretty heavily for your pain.
Right.
But you ended up going off of it a few months ago, and you've managed so far, so that's good.
Yep. The other thing, vitamins. Especially with the malnourishing surgeries, your body does not absorb vitamins in the same way. Along with the fat, protein, and carbohydrates that it does not absorb as much of, there's a whole list of vitamins that your body doesn't absorb as efficiently. So they make specific bariatric vitamins, and those you're on for life.
Yeah, you've been having some challenges in itself with finding a vitamin that works for you.
Right. There's many different options. There's the chewable, chalky type of vitamins that...
Chalky is actually is a generous term. They're really, really bad tasting.
Yeah. So I handled them for the month before the surgery. They like you to get started and get used to taking them. I had a lot of trouble after the surgery.
Yeah, your taste changed, like in a way that made them taste worse than before.
Yeah, they tasted more bitter. And then also when I did get them down, they did not settle well in my stomach.
Yeah.
So I have switched to a pill form. The difference with the pill form is you have to take your calcium separate in a chewable form, and you can't take the calcium within 2 hours of taking the vitamins, and you have to take 3 of them spread out through the day. So
yeah, it's a chore keeping track of all that. Those ones were big horse pills too. They were hard for you to swallow.
Yes.
So we found one where you can take 2 a day, and they're a little bit smaller. So
yeah,
hopefully,
a lot more manageable.
Yeah, that's something that someone may have to play around with, find what works for them. But in the end, you really do need to take them.
Mm-hmm.
So, or bad things can happen, like losing hair,
right,
or stuff like that. So, what about foods? Like, there's some foods that people have trouble; they can't really eat for life afterwards.
So very, very fatty foods and very, very sugary foods can cause a something called dumping syndrome, where it causes your digestive system to speed up way too fast, which causes dumping out of both ends. So
not something a person wants to experience.
No.
Fortunately, with the surgery you got, that's less of a risk. It still can happen, but
yes,
it's less of a risk than for people who got the Roux-en-Y.
Correct.
But then, like, there's also starchy foods, like potatoes, things that you would consider healthy.
My surgical program does not want me to have white potatoes ever, because they can expand in the stomach. I have read conflicting information. There's a lot of other surgery programs out there that do allow potatoes. So it's really
on a case-by-case basis.
Yeah.
Yeah, my sister-in-law actually had the regular duodenal switch, and she said that she doesn't really have problems with potatoes, I think.
Right.
But she still like avoids things like the white gummy breads,
Right.
stuff like that.
And the biggest reason for that is it can expand in your stomach, and that sleeve can then stretch out.
Yeah.
Um,
You don't want to go through all that work and pain and trouble just to undo all the good you did.
yeah, so especially early on, you can, if you eat them way too early, you can actually cause that to separate and cause leakages, or later on it just expands the stomach, and you kind of get a lot less benefit out of the restriction of how much you can eat.
So, what about acid reflux? That can be a problem for some people.
It can. All of the surgeries with the sleeve, it's a higher risk if you have acid reflux. And that's the time where they suggest you to go over to the Roux-en-Y surgery.
Yeah. You had a little bit of a scare earlier this year with heartburn. You started having it regularly, and so we thought maybe you were developing acid reflux and that you wouldn't be able to have the SADS surgery because of that. But fortunately, I think it was just a temporary bout because of stress. Not that stress is, not that that's good that you had stress, but it's good that it was temporary.
Right.
And you haven't really had problems since then.
Correct.
Oh, and in fact, that's another thing is they make you take medication for acid reflux for several months after.
I believe it's 3 months, and they want
whether you have symptoms or not, you have to take it.
Yeah, they also explain that they want reduced acid, just to allow those incisions to heal a little bit better.
Mm-hmm. So, alcohol was something. You can't have that for like an entire year.
Yeah. So some surgery programs are 6 months, some are a year. Mine highly suggested a year. The biggest reason that they gave for that is for transfer addiction. They don't want you to trade an addiction for food for an addiction for alcohol.
Mm-hmm. That's kind of crazy. That's a problem for some people, but also it can be hard on your stomach while it's still healing too. But yeah, for people that might have an alcohol problem, that's something that they really need to get under control before doing something like this.
Mm-hmm.
Smoking, that's not an issue for you, but once again, they say don't smoke for life.
So again, it was explained to me, as far as smoking, it's really all nicotine products. Nicotine products can contribute to ulcers in the stomach.
And slow healing.
Yeah, it also slows the healing. They also said no marijuana for life as well, because of the slow healing as well.
Mm-hmm. Something people may not know about is the fact that you have to lose weight before you go in for surgery to qualify for it.
Yeah. So you have to lose weight, and it's some of it is insurance related, but like you have to do it to meet the insurance requirements. But the main requirement is to reduce the pressure in the belly.
Like the liver, shrink the liver.
And to shrink the liver.
Mm-hmm.
That gives the surgeon more room to work in and around, and makes the surgery a lot safer.
Yeah. So you have to be dedicated enough to want this help to be able, so you have to at least have enough discipline to lose this, 10% of your weight. Is that what he said?
Yeah, it was 10 for me. It was 10%.
Yeah. So you have to do that on your own. before they'll even consider doing surgery.
Yeah.
But that was actually pretty good motivation for you.
Yeah.
So, and knowing you only had to get to that before you could get the help.
Right. So I was able to lose 60 pounds before the surgery.
Yeah. That's not something to sniff at. That was a good amount of weight. So moving on then to the day of the surgery, did you have any kind of thoughts going through your head before surgery? Were you worried, like scared about going under or anything like that?
It was my first major surgery, so of course there was some worry. But again, it's really been, seriously thought about since 2019. So that's what, 4 years now that I've been seriously thinking about this. So it was not, crippling anxiety, but of course, being my first surgery, it was, I was somewhat nervous going in.
Yeah.
So
I think I was probably more nervous than you
probably
at the thought. But
probably.
I didn't have the benefit of anesthetics to calm my nerves like you did. So
yeah, I think it's a little bit personality too.
And I had your parents there to help me.
Yeah.
So what about after waking up? Do you hey now?
No, just the way you said it, it sounded like having my parents there added to your anxiety.
Oh no. I apologize, Paula and Kent. That is not what I meant. So how about waking up? Do you remember much after you woke up? Were you like thankful to be alive and that things went well?
Not really.
You weren't thankful to be alive?
Well, that wasn't
That's
a
not
forefront
what
of my mind.
Okay.
So it was really just like the waking up from a deep sleep. And there were recovery nurses there. I was in the recovery room. So I was in a different room than when I went to sleep. I just remember getting some ice chips and really wondering when I was going to be able to see my family. Because they like you to wake up and then they like to bring you to your actual room that you're going to stay overnight before you meet up with family.
Mm-hmm. So how was your hospital stay? What was it like? What happened during it?
A bed was uncomfortable, but that's somewhat to be expected. The beds are really designed for them to work on you and not for you to be comfortable. The pain that I had, especially early on, I had more back pain just from not being able to do the stretches and things that I normally do to alleviate my back pain. I couldn't really do too many twisting motions or anything like that, which I have a lot of twisting stretches that help the back pain. So that was actually more severe than any of the stomach or incision pain.
Yeah. You had some discomfort like when you would belch.
Yeah.
And there was a lot of belching.
Yeah.
But I was kind of surprised by that, the fact that I thought maybe the stomach pain would be more severe or long lasting than it really was.
Right. Stomach pain was, the worst of it was the first week, and it was really only when there was air, trapped air and things like that. Mm-hmm. So there is a significant amount of air, especially that first day or two, because when they go into work, they fill your body cavity with air to give them room in order to see with their cameras and for their instruments to move around safely. So your body cavity is full of air. And then once they finish making all of the closing all of the incisions, sewing it all up, they actually inflate your stomach and intestines to make sure that there's no leaks. So
all that air has to come out sometime afterwards.
Right.
And it isn't pleasant for a lot of people.
Right.
A lot of people say that pain is worse than the belly pain, even.
Right.
So they had you up walking, like, on the first day.
Right. That is primarily to help get the air moving.
And prevent blood clots.
Yeah.
Things like that. It also speeds healing when you get moving.
Correct.
I think it moves the blood, gets things to the areas it needs to heal. So what kind of, like, food were you on while you were in the hospital?
So while I was in the hospital, I was on clear fluids.
Fluids, yeah.
So, broth was the least clear thing that I was able to have in the hospital.
You weren't really fond of their broth, though, because it was kind of like that powdered bouillon, really fake tasting stuff.
Yeah, so their beef broth was particularly terrible. So
hospital
the nurses,
food, right?
and that's the only thing that the the kitchen would bring up. The nurses actually went and found chicken bouillon for me so that I could have something other than the beef bouillon.
Yeah, there was actually a nurser that was particularly very nice and went out of her way. She even brought you up icy hot for your back from her own locker, from her own supply.
Yep.
So shout out to Deanna Massey. Thank you. And, like, one of the things that's funny, it was another contradiction, is they brought you Jell-O, which you weren't really supposed to have.
Yeah, so the nutritionist beforehand said, do not eat Jell-O because
it's too thick.
Yeah, really it swells up right at the top of the stomach, so you have a very, very small opening that can go into your stomach. The Jell-O can be too thick and actually sit on top, and then all the other stuff piles on top of it in your esophagus.
So he avoided that. He didn't eat that. I'm not even sure if that appealed to you anyway, but
not really.
So something you were having trouble with there was urinating. You weren't able to go to the bathroom for a little while.
Yeah, it was evening time that first day before I went.
They were threatening to put a catheter in you, and that sounds terrifying. Honestly, I've never had it done, but I don't want nothing shoved up there. So, so I think they scared you into peeing finally. Yeah,
I really didn't have any pressure in the bladder or anything. It wasn't a real. It wasn't a painful thing. It was just didn't have to go.
So how long was your hospital stay? Was it about what they said it would be?
So from what I'm reading online, a lot of surgery programs do 2 to 3 day stays. My surgery program, they really push a 1 day stay or a 1 night stay. I was having trouble keeping fluids down.
Well, you weren't throwing it up, but you were just having trouble.
I was having trouble getting them down.
Yeah.
It was causing a lot of air to move around and just a lot of stomach pain in order to drink fluids. Yeah. So I wasn't able to meet my fluid goals that first day. So they extended that so that I could be on the IV another day.
Now, I know they say that for some people who have that surgery, well, any surgery really, nausea can be a problem for a lot of people. I don't think it was as big of a thing for you.
No.
You had a little queasiness, but
Yeah, a little queasiness, and there was one point where I almost threw up in the hospital overnight, but
I don't remember hearing about that, but
yeah,
I'm glad you didn't, because like I don't know, it doesn't sound pleasant having a newly stapled stomach and like puking and retching like that.
Right.
So I'm glad you didn't. So yeah, you were there 2 nights.
Two
Right?
nights.
2 nights. So you were a little bit of a late bloomer, but
Mm-hmm.
you didn't actually like leave outside of the estimated time.
Right.
So, so what has been the most like challenging part since leaving the hospital?
The most challenging is getting enough fluids and enough protein. So it's you cannot gulp. So you have to get 64 ounces of fluid, and you have to do that at a rate of about a tablespoon every couple of minutes.
Yeah, that's hard for people like, I don't know. I think you were the type of person that, you know, some people gain their weight by grazing all day. Other people do it just by eating a couple really, really way too large meals. And I think that was more of your problem. And so going from that to like nibbling and sipping all day long, that was just a huge habit for you to change.
And then the protein, you have to stop drinking a half hour before you eat, and then wait a half hour after you eat. So eating, you know, foods that are just that are high in protein, you need to get between 60 and 80 grams of protein. And given that I am a taller person, I feel like I need to get towards the higher amount of that. It can be tough with a very, very small stomach. So and just 4 ounces of meat will just make me feel absolutely completely stuffed, and it'll take me roughly a half hour or even a little bit longer to eat that much.
I kind of feel like I'm feeding a toddler these days. You know, you nibble at it and then there's food left over on a plate. That is not something I have ever dealt with you. There's never been a problem with leftover food on your plate before.
Right.
So, so yeah, I'm kind of getting past that stage where like, oh, don't waste food. Like, no, it's okay. You can waste food. It's allowed.
Yeah.
So you've had some problems with fatigue too.
Yeah. I've never been a person that naps, but now it's not uncommon for me to nap, at least in the last 2 weeks. And some of those are naps that I just can't really put off. I'm just very tired.
And they said that's pretty normal for people who've gone through surgeries. Just your body's healing. It needs extra rest.
Yep.
So, and then just in this last week, you were having some trouble with dizziness.
Yep. So it really came down to 2 different root causes. The first one that was identified Friday was low blood pressure. Really Thursday it was identified. And then throughout the weekend we stabilized the blood pressure with
cut your pill in half.
Yep, changing the blood pressure medication.
That's partly due to just your change in diet. You're not eating as much, so
yep,
it's not forcing your blood pressure higher like it used to.
Right. So reduced weight. I've lost 20 pounds already.
Yeah, that's pretty crazy.
After surgery. And then on Monday, I was still having dizziness, called the nurse. And we kind of settled on it could be low blood sugar. So upon hearing that, force fed me applesauce, which I've had a lot less dizziness since increasing the amount of carbohydrates that I have.
Yeah, I'm really relieved that that seemed to help solve most of the problem, because I was starting to get a little concerned there. You were just dizzy all the time, just not feeling good. So, but yeah, for anybody out there who's having problems with that after surgery, you know, get those things checked. It could be any of that, really. And so were you surprised by anything, like anything you didn't expect?
I should have expected it, because they told me over and over again, you know, with the portion sizes that I'll be eating being so small. You know how they always tell you a deck of cards is the size of meat that you should have. Well, you know, my size of meat is, you know, a 20-ounce ribeye.
Yeah.
So I'm like, yeah, right. Whatever. But now, given that it's difficult for me to eat a full...
You struggle to even get that deck of cards down.
Right.
Yeah.
Yeah, I surprised to struggle at getting that much down, rather than that being the recommended amount.
Yeah. You know, the thing that surprised me was you mentioned your weight loss. It was just in the first week you lost that 20 pounds, and I knew...
First 8 days, yeah.
I knew that the weight loss would be quick to begin with, but I had no idea how quick.
Yep.
And that was just kind of insane to me.
Yep.
Now, upon almost to the day, on your first day, on the end of your first week, that's like when the weight loss just stopped, and now it's been stuck.
Yeah.
Right there. I don't know if your body's just...
So I think it was the first
protest.
9 days that I was losing at a very, very rapid pace. And then I am still the same weight as I was on day 9, and this is day 15.
Yeah. I think it's probably just your body's way of being like, whoa, hey, what are you doing?
Yep.
We're going to put the brakes on this. But
I think
there's no way you can eat as little as you can and not have it pick back up again.
Right. I think my body is just holding some water, and that can be healthy. You don't necessarily want...
You don't need to lose that fast, really. So,
yep.
So what does your recovery look like from here on out?
So right now, I have progressed through the what they call first 3 stages of nutrition. I'm on the 3rd stage now. So first stage is, clear liquids, then full liquids, and then I am now on puree.
You're living the real life now.
Yeah, living the real life. I can eat real foods, but it has to go through a blender.
What kinds of stuff are you eating right now?
So I'm eating some soups. So I found that I can tolerate chicken tortilla soup. That gets me, you know, some more of the flavor, so it's not as bland. Been eating a lot of cottage cheese.
Cheesy eggs almost every morning.
Yep, cheesy eggs in the morning. And some chicken and some tuna.
Yeah. So the funny thing is they were really pushing that you eat a lot of the protein, but in our experience, we have found that it is kind of important to make sure you get a little bit of those carbs too. Yeah. Because, like we said, you were having those blood sugar problems. So fitting a little bit of that in with your protein is important. But, so like the other stages you'll progress to then, or what?
So after this stage, I have 8 weeks of soft food. So nutritionists really kind of explain that as like the crock pot stage, moist, soft foods.
You'll still have to avoid like really fibrous vegetables though.
Right. No raw vegetables, no raw fruits. And then after that period, it's 12 weeks of introducing new foods, introducing the raw
so it's like
vegetables.
Almost normal.
Yeah.
Like, yeah.
And then after that, it's your lifetime
diet, whatever you can or cannot tolerate after
Right.
that. So your incisions are healing up pretty good too from the laparoscopic incisions.
Yeah.
They really don't look that bad. They just look like little cat scratches to me.
Right. I really have no incision pain right now. The pain from the trapped gas is going way down. So almost no stomach pain, almost no incision pain at this point.
You're even planning on going back to work later this week, this Friday. You were planning on it?
Yep.
So, yeah. Recovery really hasn't been too bad, but is there anything like maybe you're worried about for the future?
A little bit nervous about not being able to eat some of my favorite foods. Steaks are...
I think you'd cry if you couldn't have steak.
Yeah. I think I'll be fine being able to. But, you know, they say, you know, it just kind of depends. I've not tried eating beef yet. They don't say it's not allowed, but they say it can cause a lot of trouble early on. So I'm trying to graduate through things slowly.
Yeah. They say there is a risk of stricture. Was that where like the opening to the stomach like tightens up or something, or becomes inflexible so you can't fit food down? They say that sometimes happens between like the puree and soft food stage. So that's a hurdle we kind of have to get past and hope doesn't happen. They say if that happens, they have to go back in, stretch it back out. And usually it's fine after that. But I really don't want you to have to go back into the hospital again.
Right.
So then kind of like going on to, you know, people in the outside world, sometimes people say that getting bariatric surgery is like the easy way out, or that you're taking unnecessary risks for, you know, something trivial or things like that. What would you say to that?
So I don't know of anyone that's done MyFitnessPal or Lose It app or Atkins diet or any of the fad diets that are out there that have had to go under general anesthetics, be in the hospital for 2 days, be off work recovering for 2 weeks, and
possibly not get to eat any like certain foods for the rest of your life.
Being incapable of eating some of your favorite foods. If you feel that is the easier path, then more power to you. I just do not buy into that idea.
Yeah, I don't think it's been easy. Like, I feel like a good part of our day is just taken up by trying to figure out what you can or can't do as far as food goes, or things like that. Figuring out all your vitamins and medicine regimens. Oh, that's something we didn't mention before too, was like some time release medications you have to switch over, and then you have to take it twice a day instead of once a day. So it really does disrupt your life, but in our case, like, it was kind of like, if your hand is making you stumble, cut it off, or if your stomach is making you stumble, cut it out.
Yeah. It's really a risk versus reward type scenario. And really it's a matter of, I mean, genetics kind of loads the gun and the environment fires, but, you know, my genetics are predisposition me to higher weight, and a lot of that is the hormones in the body, and then the environment. It's standard American diet.
Yeah, a lot of doctors are starting to come to the conclusion now that it's kind of a losing battle for a lot of people out there trying to do things a traditional way. So for some people, bariatric is like the last shot you've got. It wasn't something we did lightly either. I mean,
No.
You tried other stuff. You were even considering going on medication. but
Yep. We even had to pay for the entire surgery ourselves. So.
yeah, that wasn't easy. That hurt.
Right.
So what kinds of things, on to a more positive note, what kinds of things are you looking forward to in the future?
There's several things. Being able to be more active. I travel a lot for work. So I spend a lot of times on planes, so not having to ask for the extra seat belt every time I board a plane will be a very welcome thing. The not having to feel guilty sitting next to somebody that you know, I feel like I'm encroaching in their space. So I always try and get an aisle seat, and then I'm always leaning like this out to the aisle to try and give the person next to me as much space as possible.
And then your back's killing you afterwards?
Yes.
Buying clothes will be a lot easier too, because you won't have to order out of a catalog made special for larger people.
Yeah. I'm not as much of a fashionista, so it's like...
No, but it's still frustrating, even just trying to get, regular clothes that fit you.
Right.
It's a frustrating experience.
Right. But this is certainly not, certainly wasn't done.
Out of cosmetic or vain reasons.
Right. It wasn't done for fashion or to feel like I fit in more or anything like that. It's those,
you've
as
always
far
been
as
confident in yourself, before then and now.
Yeah.
So I'm really looking forward to just like being able to be more active with you. Like, I remember early in our marriage, like we were kind of adventurous. We used to go on hikes together and like do a lot more active stuff, and it's kind of become harder to do stuff like that, if not impossible. So I hope that's something we can do again one day.
Yeah.
So I think that's pretty much all I have, unless you have something else to add at this point. I hope maybe some of you viewing this found it helpful. If you have any questions, please feel free to leave them down below in the comments. I'll either try to answer them in the comments section or address them in the next video. And we'll probably, I'm not sure when we'll do an update video, but maybe in some of the next, stages of food or something, or as you lose more weight.
Milestones or whatever.
Milestones, yeah. So we'll keep you updated. Thanks for watching.